we start with the first question then. So we're keen to hear from yourselves any barriers that you think exist around different communities accessing support for mental health services in the community.
There's a few barriers. Years ago, families were reluctant in accessing any support because there was language barriers and there was lack of experience, you know, families going through mental health issues and also mainstream services supporting the families. And I think there's nowadays, I mean, it's still the same, but it's improving slowly. There's a lot of mental issues out there, you know, there's depression, anxiety, and then there's other mental health issues like bipolar, schizophrenia, personality disorders. Families don't understand, you know, they get scared, they don't know who to talk to, they feel like they're going to get judged, you know, they feel that somebody's going to be coming into the families and they're suspicious about who's going to be coming, what kind of questions are they going to be asking, are they going to be nitpicking everything in the family, you know. So there's a lot of reservations, i.e. with the communities there's a lack of awareness about mental health issues, you know, the form of people when they get depressed, you know, ideally it's go to the hospital or doctors, you know, get a diagnosis. It goes too late. People are getting diagnosed too late and it results in a serious mental well-being. Families don't take it serious enough. They were like, oh, it's fine, you know, she just needs a little bit of break from the kids, or they don't take it seriously, so it's shoved under the carpet until it's too late. Especially women are not seen as, you know, if they went to GP, it's frowned upon from the husband. If the wife accessed antidepressants, they feel that she's weak in some sense, that she's not strong in looking after the family, looking after the kids. They'll see it as a weakness. So there's issues around that. There's issues around the services, you know, are they, you know, can they support families from BAME communities that are suffering from mental health issues? Who do you go? You know, have we got access to, do people know where's the crisis, what's the phone number for crisis service? Do people know, do they know what to look out for, you know, for mental health issues? It's talked about, but I think it needs to be broken down, you know, because it can be stress related, it can be a bereavement in the family, it could be just somebody that's just been overwhelmed and they need that support. So there's a lot of awareness that we need to do as a community, as health professionals. I think we need to work together. And my main concern is people in our BAME community just not getting the help and support. They're in crisis situations and they don't know who to turn to. So they're doing it themselves. You know, they're looking after their son or their daughter in the family home, and their mental health well-being is deteriorating, and it comes to a point where it's too late and they have to be sectioned under the Mental Health Act, and it shouldn't get to that position. Also, if you look at dementia, some of our community, you know, we've got a high percentage of people in the BAME community that are now being diagnosed with dementia. But again, the lack of awareness, they're not getting diagnosis quickly. And also the families don't understand that there's no cure for dementia, but there is management of dementia. You know, you could go to a memory clinic and get your loved one assessed. If you have an early assessment, you'll get an early diagnosis. It's not being left